Increasingly in British Columbia, the patient voice is being heard in doctors' offices and at decision-making tables. Here's what some providers have to say about why they started engaging patients.
One of our key strategic directions focuses on the care experience, and part of that is how we bring patients into our decision-making structures to support how we design care and service at Providence Healthcare.
Because the patients have a huge amount of insight, experience, information to add to the process.
It really provides an opportunity to truly have a consumer focus to our healthcare services.
The stories they have told and the experiences they have shared have helped me work with other patients.
Compliance went up, and that actually the interaction I had with them became more interesting.
If we hadn't involved patients in some of the work that we've done in the organization, I think we could have gone down the wrong path or really focused on priorities that may not be the true priorities of the people we serve.
The impact of having people tell their story is that very often it's a showstopper. It stops the room cold and can sometimes change the direction completely.
Having these folks at the table has really illustrated how it's so hard for us to separate our patient role from our provider role, and in fact we really can't do that very well.
I think one of the pleasant surprises was the willingness of patients to be involved in opportunities within our organization to be part of some of our decision-making and planning structures.
And they were recognized by everyone as full team members, and their opinion counted just as much as everyone else's, and they were able to bring in things to the conversation, to the discussion that none of us would have thought about because we're there with our healthcare hats on.
These patients are inspirational to their peers, and it has been my pleasure to share their stories and experience with other patients. It has helped me encourage patients that may have been less inclined to go a particular direction.
That they need to be sincere in how they're going to commit to involving patients in their planning processes or however they wish to take advantage of the patient voice.
Bring the patients on board at the very beginning of the redesign work or whatever it is that the group is working on. Bring them on as full team members.
We should not just assume that what we think is important or what we think is useful or how information should be delivered to the patient is necessarily the benefit to the patient.
Learn to process what you're hearing and be humble in the degree to let it change what your plan might be.
I would definitely recommend that other organizations employ the patient voice in their decision-making structures, their hiring practices. It's a perspective that's very important.
Because the patients, they're directly involved in what those decisions are going to be, and they have to be part of the discussion.
I mean, the end result is a more responsive system, a system that's more aligned with patient need, and quite frankly, a system that's safer and less at risk for adverse or litigious outcomes.
I think we need to empower the role of the patient and validate their role, and I think we will all benefit from that experience.